Hello, my friends, my family, and my fans. I am Andy, and I am diagnosed with autism and intellectual disability. Today's topic is important to talk about mental health and mental well-being of society. President Trump's well-known slogan is Make America Great Again. RFK made a commitment to investigate the causes of autism and improve the healthcare system. 2 weeks after RFK claimed Tylenol caused autism, he retracted that statement. He also pledged to address diabetes and other health issues by removing certain ingredients and implementing further changes. President Trump changed public benefits rules, introducing new requirements for Medicaid eligibility and making adjustments to the Affordable Care Act. These changes resulted in some people losing their benefits or facing higher healthcare costs. While I support work requirements and drug testing for public benefits, these new rules have created additional barriers for people with disabilities seeking insurance. I see big problems with society, and it is not a quick fix. I see we have left behind people with disabilities and low income behind. It all starts with how we raise children and the education system. If our children are educated and set up for success with skills needed for adulthood, we have lower unemployment rates and more skilled labor. That will lead to less crime and healthier nations. Raising minimum wage is a solution to bring more income for working adults, but it is not fixing the crisis of how much it costs to live in America. This leads to both parents needing to work and spending less time with their children, making less social and emotional development for children. This leads to more isolation, my social media use, more time playing on electronic devices, less time outdoors, and exploring the world around children. That results to lower intelligence, unhealthy habits, obesity, poor social-emotional development, poor infused control, and critical thinking skills our children need for a successful future. Making more risk for developmental disabilities, more risk of mental illness, more health and disability claim on a failing public assistance system. This will make drug use and crime rates higher. More homeless and vulnerable populations with nowhere to go for help. Add to the immigration system that floods our country with migrants to feed off of our social welfare system. The United States is failing us citizens. Here is a fix for long-term results that will take decades to see better life in America. Start with our children and youth who will be supporting the workforce and future children. Let's fix how much income parents have to spend on them. Why are parents not spending time with their children? They must work more to be able to afford basic care needs. Why can't parents afford things? Taxes are high. The cost of medical care, the cost of housing, utilities, childcare, cost of clothing, food, and other essential things for households are too high. The workforce has a lot of options. The problem is that most skilled labor has shortages because the cost of college is too much. The medical field is crap for doctors and providers to get any income. The red tape to health care for patients is difficult to navigate. Doctors don't want to work and quit the medical field for other jobs. Insurance companies don't want to pay doctors for the time and service. This makes patients in a hard spot. You have high costs for education and healthcare, so not much skilled labor, making shortages in specific areas. The cost of living is too high. How we fix this? I like the tariffs idea, as that will make coordinates come to United States to make their products. Tariffs only go so far unless we add incentives such as lower taxes and kickbacks for companies to come to the U.S. for production. Then we need the labor force. I think President Trump has fixed part of these issues. Now he needs to focus on the medical system to support the health and mental health of our nation. I feel after we get that done, we need to lower the cost of medical care. We need to eliminate the middleman. The problem is the person who doesn't work for pharmacy, doctor offices, hospitals, insurance companies who negotiate the prices for services and medical equipment and medications. What if government sets up a price for certain medications, service, and care that insurance can only charge and pay for? Add kickbacks to pharmacy for research and development of new treatment options for cutting cost of this important medical care. Like changing the advertisements on TV and bragging rights that drive cost of prescriptions. Make a universal agreement for pharmacy to work together instead of patients that make name brand medications expensive. on top of grants and kickbacks, and changing advertisements for development of new treatments and drugs, adding all pharmacies who make or sell prescriptions to have a cost sharing for research and development. We have CVS, Walmart, Walgreens, and small mom-pop pharmacies. So let's make changes for the pharmacy to keep their name, but make universal prices to drugs. We have Pfizer, Abbott, Johnson & Johnson, and other drug manufacturers. Let's keep these the same name, but with cost sharing. Bridge the supplement pharmaceutical companies and pharmaceutical together for both the retail and manufacturing with cost sharing. This will eliminate the competition for drugs and making the cost of medications less. What if the primary care doctor who oversees the entire health of patients is that person who gets all the services, specialist, medical care, medication, medical equipment for the patient by referrals and prescriptions, medical orders, and other things? Not only a cost sharing for the manufacturing and development of medications and treatments of medical conditions, kickbacks from government, and elimination of the middleman will lower the cost of treatments. We also need to make a sharing of cost and profits from the doctors as well. This system should be set up to if one company, such as Pfizer, has lower profits than Walmart Pharmacy, the cost sharing will help supplement the cost Pfizer has to deal with. When one doctor has less profit from another doctor, the cost sharing supplements that. Also, when a doctor and pharmaceutical work together with cost sharing with no favors for anything, so it is equal all the way through for all brand names that will help everyone to bring high level of care to patients and cost less. Let the reviews of patients and feedback from peer reviews of different brands and providers make more kickbacks like lower taxes and more grant opportunities to help individual brands have some competition. Let the cost sharing balance the competition for the prices to be low, but compensation of quality of care and products to be a gold standard. Having a way for set prices for service and health products with cost sharing for development and research will help lower the cost. This is a hard fix for this to be done. If we have Congress work together to fix this, it will make more treatment and care for patients who need it. Implementing universal cost-sharing frameworks for manufacturing and essential goods, free from government taxation but supported by tax returns, can reduce production costs and living expenses. Regulations should prevent companies that manipulate prices or avoid debts from benefiting unfairly. Increasing wages and financial resources for consumers will decrease reliance on welfare, lower crime rates, improve mental health, and allow families more quality time together. Education should address children's individual needs, especially for those with disabilities, by offering specialized schools, mandatory school-based mental health care, basic life skills, and support for emotional well-being. Anti-bullying efforts must be prioritized and reporting made accessible and stigma-free. Laws restricting device use in schools and introducing age and ID requirements for social media can foster safer environments for young people. Prioritizing affordable health care, food, transportation, and housing supports families, promotes employment, reduces crime, and strengthens society's overall social and emotional development. Wouldn't it be nice to not have to worry about crimes, cost of living, education, and childcare? Wouldn't it be nice to live more comfortably and have better health? I'm not a Donald Trump supporter and cannot vote. As a person with a disability, I share possible solutions and advocate for disability, autism, and medical care rights. This channel focuses on educating disability symptoms, needs, and inclusion, as well as promoting self-advocacy and human rights. If you find this helpful, please like and subscribe for more content.